Hey there, new patient group family. It's Coach Eric here, and welcome to this week's 5 Fantastic Minutes. So great to have you on board. Going to be grabbing an idea that comes from one of our on-demand courses, and the course is Connecting the Dots. All right, so what's this course about? Well, it is about connecting the dots between malocclusion and unwanted events that are happening in the oral health environment. All right, why do you think I want to go into this today as part of this week's 5 Fantastic Minutes? Well, it really has to do with, I feel like there's a great value, tremendous benefit in everybody in your organization, from the most obvious being the doctor, clearly an absolute master of malocclusion and understanding, but into the exam room with a treatment coordinator who's looking at photos daily, looking at the digital images daily, is having an appreciation for what's going on in that patient's oral environment. Chair side, right? Even though it might be placing braces, it might be working with aligners, it might be grabbing records, having an appreciation for what's going on in that patient's care. And even up to the front desk, whether we're answering the phones or we're in the hospitality of working with new patients, existing patients, tremendous opportunity for everybody in the practice to have some level of understanding around these connections. We have a malocclusion present in the patient's mouth. We certainly can appreciate the cosmetic benefit and advantage that a patient may desire, but do we have enough understanding around the health and the clinical benefits and advantages of when we get that patient's teeth into proper alignment? Right, and that's what the course is about, so I hope you'll take some time to dig into that course. But what I want you to do right now as part of this morning huddle, or wherever you happen to be watching this video, is I'm going to share a set of some patient images. And I'd like you to spend some minutes, some time in this environment looking at these patient images and work independently initially, right? Don't just jump in and start sharing or having the doctor obviously take over with their knowledge, but work independently to write down a couple things. What do you see that are unwanted events that are happening in this patient's life? Maybe it's wear patterns, maybe it's recession of the gums, maybe there's other evidence that you're seeing that's unwanted. And then ask yourself, why is it happening? What is it about this alignment in this patient's environment that's contributing towards these unwanted events, right? And this is what we call dental CSI, right? It's the crime scene, right? It's stuff that's going on that we need to solve the crime about why it's happening. And the more that we can understand, the more that we're going to be able to appreciate their needs, and the more we're ultimately going to be able to educate them about those situations. And that's our goal as we go through this short training. So take a couple minutes and then share in some discussion, and definitely we have the doctor then filling in the holes of what they see so that we can walk away more educated and more prepared. So enjoy this time together. Make sure you're liking this video as part of our YouTube channel. Make sure you're following our channel as well. And definitely, if you're not already, subscribe to our monthly new patient group podcast. Look forward to chatting with you all soon.